I think it's really important that you feel like you're part of a family and that you're not just a number, that we are taking care of you as a whole person. I think what I love about GYN oncology is I get not only to know the patient, but I know their family, their friends, their support structure. I feel like, looking at all aspects of their life and seeing how we can impact that in a positive way is important. So I feel very fortunate. My staff has great relationships with my patients as well. A lot of times patients will come by just to visit the staff, not even just to visit me, and I think that's wonderful. I think they feel very connected to the Brown Cancer Center, and I think that's very important. You feel more confident when you feel loved and you feel like you have a home. I think Stacy's really got a great attitude toward life, and she comes with a very positive attitude. And I think going into treatment, she's very open to suggestions I have. We kind of think of it as a team approach to things, and she really participates and really tells me what's important to her, what she needs, and I think that helps guide me in what treatments might be best for her. We have a tumor board that meets once a week where we go over every patient's care that's new to us or a new surgical diagnosis. We go over the options for treatment. We have not only my partners, but also we have the radiation oncologist, we have pathology. Everybody participates in that process. So it's nice for patients that they get a group opinion as opposed to just one person's opinion. I think that's important. We have clinical trials people there as well. We identify patients who might be eligible for trials. So I think you get the best of both worlds, the research side of things, but as well as the translational research, as well as just the clinical opinions. I think it has all those positives about it. I think one thing that I've really been trying to make people aware of is a couple of things. One is know your family histories. Again, hereditary cancer, we've made big strides, and we have a hereditary high-risk clinic which allows us to counsel patients and test appropriate patients for those genetic problems, that we can be proactive, we can do prophylactic surgery, we can take preventative steps to keep them from getting cancer, and I think that's really, really important. We've been fortunate to push the envelope in the utilization of minimally invasive surgery, so robotic and laparoscopic surgery. I think that's very much impacted GYN oncology. Again, not too many years ago, those patients were all getting incisions, and now about half of our patients we can use minimally invasive surgery, and I think that's a plus for patients. They get on with their therapy sooner, they recover and get back to life faster, and that's a positive. I think on the treatment side of things, I think that there is really an advance with biologic agents and combining them with chemotherapy, and the goal is to really identify how a tumor, again in Stacy's case, tumor biology, how is her tumor different than, say, another patient's tumor, and we need to really individualize our treatment as opposed to really saying, gosh, I have a stage 3 ovarian cancer, I need to use X and Y and I have to stick to that. So I think as we get smarter about tumor biology, then we can really focus on targeting tumor in that way.